Welcome to the Wits Occupational Therapy Treatment Planning process for clients with physical conditions. This is an overview video showing the process from beginning to end, but following videos will expand on each section in a bit more detail. So firstly, we start with our clients, who has their background information and their diagnosis, which is causing some sort of occupational dysfunction. From this, students select which assessments they want to conduct and administer the assessments. Just to note that the assessment checklist is on page 49 to 51 in the treatment manual, and this allows students to select which ones are going to be most important for this client. Important to note that the clients, although they have a physical condition, the students should be assessing physical and psychosocial components. So for example, if you have a spinal cord injury client, they might be conducting sensation, muscle strength, range of motion assessments, but also should be assessing motivation, energy and drive, insights, and other relevant client factors and performance skills. Also, although assessment is a second year skill that should be consolidated, this is the first time that students are seeing a client for the full treatment planning process and also are seeing a variety of different diagnoses that they might have seen in second year. So they still might struggle or select inappropriate assessments and might need some guidance with selecting all the appropriate ones. After conducting all their assessments, they will then draw up problem lists. Problem lists are summaries or bullet points of all the assessment findings where the client has problems under 4 respective lists: lifestyle, physical, psychosocial, and the categories of occupation. These will later form into aims lists, which will be used in their daily treatment planning. But before we go on to formulating aims lists, we need to understand what phase the client is in, what is their prognosis, which approaches we're going to adopt, the frames of reference to understand what treatment principles need to be applied, and then also the models. Starting with the phases, this is the timing of the disease or injury or illness, and there are 5 different phases: acute, restorative, chronic, pre-discharge, and palliative. Third years are primarily going to see clients in the restorative or chronic phase. This is going to inform, with many other factors, the prognosis of the client. The prognosis of a client can be good, fair, or poor. A client ultimately with a overall good functional prognosis will look at mostly a restorative approach, where we're going to look at improving their client factors and performance skills and their functioning in their categories of occupation. A client with a poor prognosis, on the other hand, we're going to look at more compensating or adapting their environment. But many clients will fall under a fair prognosis, where we're going to look at maybe a mix of approaches. We'll look at improving functioning in certain areas, but maybe compensating and adapting for others. This leads to the approach that we're going to use. Just important to note that you can select multiple approaches to use with one client. There are 5 approaches: create or promote, establish and restore, maintain, modify, and prevent. In third year, the client seen will mostly adopt a modify approach or establish restore approach. These approaches are then going to inform how we formulate the aims. For example, are we going to improve range of motion, or are we going to maintain range of motion? The frames of reference then further expand on the treatment principles that are going to be used in the daily treatment plans later. Similar to approaches, multiple frames of reference can be adopted. For physical, there are 3 frames of reference that we're taught: biomechanical, sensory motor, which includes Brunstrom, NDT, and Wits, and then motor relearning, also known as the Carr and Shepherd approach. Please refer to page 44 to 46 in the treatment manuals for a full list of the frames of reference that can be used. Once the student has established the approach and frames of reference that they will be using with their clients, they can then convert their problem lists into also 4 aims lists. These will also be a lifestyle aims list, physical, psychosocial, and categories of occupation. So, for example, a problem might be that a client has limited passive range of motion of their right elbow joint, and a aim would then be, if it's a good prognosis, would be improve range of motion of right elbow, and a poor prognosis patient might be maintain range of motion of the right elbow joint. Once we have the 4 aims lists, in order to prioritize these aims lists, it's important to go back and look at what the client's goals are. What is firstly their long-term outcome? This is a paragraph which summarizes a realistic view of how the client will be in 1 year's time, listing all of their categories of occupation that are relevant to them. So all of their ADLs, IADLs, and other categories of occupation that the client should achieve in a year's time. Intermediate outcomes are a shorter term goal that are steps towards achieving that long-term outcome. Intermediate outcomes are typically formulated for the period of fieldwork, and each intermediate outcome is only focused on one category of occupation. So, for example, bathing or functional mobility or work. Once the student is then able to formulate 3 different intermediate outcomes that should be achieved in 4 weeks' time, they can then reprioritize each of these lists from most important to least important. So which aims do need to be achieved first in order for me to achieve those categories of occupation in my intermediate outcomes. Once each of those lists are ordered in terms of most to least important, the students can also add a cutoff point, which is a line in the aims list where anything below the line are client factors, performance skills, or categories of occupation aims that are not needed in order to achieve the intermediate outcome. So they're still important in order to achieve down the road the long-term outcome, but just for the period of fieldwork, they're not aims that they'll be working on. Once they have those 4 lists, they can then combine it into one consolidated, combined, prioritized aims list. This helps the student then in their daily treatment planning to just select from the top of the list the aims that they should be working on frequently. As an aim is achieved, they can remove it off the combined prioritized aims list. Each daily treatment plan will have 2 or 3 aims that are focused on, and these are selected from the combined prioritized aims list above that cutoff point to whatever is relevant in order to achieve success in the activity for that session. Moving on to the daily treatment plan format, this contains firstly the activity that will be focused on. The activity obviously must be meaningful and functional to the client and should be linked to the intermediate outcome, either indirectly or directly, so as a means to an end or an end in itself. And the 3 aims that would be best selected to achieve success in that activity. And under each aim, there'll be 3 applied principles. An applied principle are the treatment principles derived from frames of reference that will help you achieve that aim. So for example, if an aim were to improve muscle strength of the right elbow flexors, the applied principles derived from the biomechanical frame of reference might be things like repetition, resistance, the type of contraction in order to improve muscle strength. The aims are then summarized into a SMART objective for the session in order to ensure that success is measurable in the session. The activity is also broken down into preparatory or adjunctive activities or exercises, the main activity, and then often a carryover to the ward or what they should be doing if they can conduct a ward program or home program. Also listed precautions are important. Baseline principles, these are general principles as well as creative ability principles, depending on their level of creative ability, in terms of what the session activity requirements should be, how to present the activity to the clients, and handling. The student should then include structuring for the session, having a picture or labeled diagram or a paragraph describing the activity, the client, and the OT in relation to the materials in order to achieve the aims. And then lastly, there should be grading for each aim for in the session and also to the next session. Thank you for watching this video. Please watch the following videos to expand on each of these sections in more detail.